Hey, Dave O'Sullivan here, and welcome to another short, sharp, actionable video to help you become that go-to therapist. So if you don't know me, I've worked in professional sport for well over 14 years now, but also have my own private practice. And I help private practice physios have the confidence to help any patient who comes through the door by using a simple pro sport structured step-by-step system so that ultimately you can enjoy a fully booked diary of happy progressing patients and ultimately get that recognition as the go-to physio. Now, here's what you can expect in each one of these short episodes over the next 6 weeks is that I will give you one actionable piece of content every single lesson that you can implement in the real world and start to see results with your patients so that you can become that go-to physio. Okay, so what I want to show you today is a very, very often overlooked key performance indicator that I do, especially before I progress my patients into standing exercises and higher level. And that is putting some low tolerance through the medial hamstrings. Okay, so again, the biceps fem as a hamstring muscle, that gets a lot of the kudos, but actually, especially with MCL injuries, very often there's a really poor low tolerance through the medial hamstrings. And often with MCL patients, especially that had them in the past, I want you to go back and I want you to check this, okay? Because these especially are the patients that will say if their knee feels a bit loose as it goes through swing phase, especially when you're trying to get them back from an MCL injury, okay? So again, this is one of my clips from the quarterly summit. Okay, so again, I'll just play it a little bit. So we're going to internally rotate the hip. Okay, so again, we're going to put more load now through this medial hamstring here. Okay, and then I'm building tension through the big toe. So I want the gastro and the soleus obviously will do a little bit here, but I want the gastro and the hamstring to work well together. Okay, and then I'm getting them to build tension here. Okay, now if you wanted to start, just push through the heel if you needed to. Okay, and then we just want to recheck that KPI. Okay, and then we want to check it in a couple of ranges. Okay, so now you can see here I'm going inwards, so this is going to put more load through his biceps fem here, so you can see that contracting. But this is the big one I want you, okay, so this is just a hands-on kind of masterclass there that I'm doing. Okay, let me get it there. This is the one I want you to really get clear on, okay, with your patients. Okay, so very often a lot of knee pain patients, they're going to really struggle to have a good motor output through here. They won't be able to build tension through the medial hamstrings. It's a nice one just to put a bit of load tolerance, see how they're tolerating load. He's reacting well here. I've done quite a bit of hands-on treatment through there. Okay, and again, these are just some of the other KPIs that we're using. Okay, so really, really important thing that I would really suggest that you check. Okay, now what do you do if they can't tolerate load? Okay, well then I'm really going to be doing a lot of hands-on work through the medial hamstrings. Okay, so whatever techniques or whatever you use, that's up to you. Okay, but I would recommend after you do your hands-on, make sure retest it and then put that tissue in a position where it's got no choice but to tolerate load and build it up into the graded exposure program. Okay, so if you want more strategies like this, okay, to help you ultimately become that go-to physio, then give me a shout. Okay, so again, I've got 24 places in this July cohort. Okay, so again, if you want more strategies to ultimately help you have the confidence to treat any patient who comes through the door using a framework and a structured step-by-step system, okay, it will give you the confidence, as I said, to be able to, even the most complex patients, just step back to think about it, use your clinical reasoning skills, understand the why behind everything you're doing, and ultimately then help your patient progress all the way to the final sessions. Okay, it'll also show you how to design value-based treatment plans. It'll show you how to do hands-on treatment without wrecking your hands, getting short, sharp changes that ultimately and most importantly are long lasting. And then I'll show you how to bridge the gap from low to high level rehab. Okay, it's the most simple and direct way to grow your career and ultimately grow your clinic while giving your patients great outcomes. Okay, so if you want to get involved, drop me a message below. I've got 24 places for July, and I'll